Well, good afternoon, everybody. My name is Mairead O'Driscoll. I'm the CEO of the HRB, and it's a pleasure to welcome you this afternoon to the HRB Grant Holders Conference for 2021. Now, normally, of course, we would meet in person in a nice hotel somewhere down the country, as they say, and we'd have the opportunity to chat over coffee or dinner. And of course, that's not possible this year. But, it's great that so many of you are here and to see the interest. I think we have about 300 people registered, which is fantastic. And regardless, I suppose, of the sort of strange online world we're all in, the purpose of our Grant Holders Conference remains the same. It's an opportunity to meet the wider HRB funded community, to share information with you, and to highlight opportunities for networking and indeed to encourage you, if possible, to collaborate. It's also an opportunity this year to thank you for all of your efforts in combating the COVID-19 pandemic. Never has health research been so important to people's lives and indeed to people's livelihoods. We know that good research makes a huge difference to people's health and to care, but our economy also needs healthy people and good health services, as we all know. So much of the well-being of our society depends on health research and the work that you're all doing. And that holds true across all areas of health. It's really important. So thank you very much. Now, a couple of housekeeping messages for you. First of all, live support is available at the top right-hand side of your screen. There is a live speech-to-text function available through either the mobile app or also through the session description on the right-hand side of your screen. And there's also a live Q&A available throughout the session also. It's all happening on the right-hand side of your screen. And we'd encourage you to submit questions throughout the session. We'll try to answer as many as we can when we get to those points in the programme where we have the Q&A sessions and the panels. And finally, we would say don't forget to visit the exhibition area where you can see information on a few of our ongoing projects. Now, back to business. We have two main themes this year for our conference. This afternoon, we are going to introduce the new 5-year HRB strategy, Health Research Making an Impact. The strategy itself isn't actually being officially launched until next Tuesday. So we would really appreciate it if you wouldn't share any of the strategy slides on social media, because we want to maintain the air of mystery insofar as you can nowadays. So we really appreciate that. The second theme then tomorrow morning is on future-proofing research. So what we're going to do then is we're going to spotlight some researcher-led innovative solutions to the various challenges to health research that have been brought about by COVID. So hopefully you'll be able to stay with us all the way through. Now, first up today, and to get us started and show what can be done when you set your mind to it, we have a fantastic keynote speaker. Dr. Lisa Maria Voipio-Pulkki is currently serving as the Director General of Strategic Affairs and the Chief Medical Officer of the Finnish Ministry of Social Affairs and Health. And Lisa Maria joined the ministry in 2010. And since 2014, she has been actively involved in the Finnish government's health growth strategy for personalised medicine, supporting the establishment of hospital biobanks, the National Genome Centre, and the implementation of a new act on secondary data use of health and social care data. We are really, really pleased to have Lisa Maria here at our conference because the use and the reuse of health and social care data, genomics, biobanking, these are really important issues for Ireland over the next few years, and they feature strongly in the HRB's new strategy. As we all know, Finland is a country similar in size to Ireland, and they've done a really good job there in organising their infrastructure for health research. For health data. So we can learn a lot from what they've done and from the Finnish experience and from what they've achieved. And hopefully this will inspire us all to be ambitious here in Ireland. So first up, over to Lisa Maria.
Madam Chair, ladies and gentlemen, dear colleagues, let me first thank you very much for the invitation to give a keynote presentation in this prestigious event. I'm deeply honored by it, and I also want to congratulate you for the new research strategy 2021-25. The title Health Research Making an Impact is something that we can all agree upon. One of the strategic objectives of your new strategy is to promote and enable the use of data to shape health policy, enhance the healthcare delivery, and drive broader research and innovation initiatives. This strategic objective has been very central in Finland for a few years now. But actually, the history of the healthcare information systems reaches back to the beginning of 2000s, when we had the first regional healthcare. One of your strategic objectives is to promote and enable the use of data to shape health policy, healthcare delivery, research and innovation. Finland is a small country in the northeastern corner of EU, and we have a population of roughly 5.5 million. Finland has valued this same strategic goal for a few years now. However, the history of the healthcare information systems is much longer, as the first regional systems actually were installed in 2002. Our health delivery system is very decentralized, or at least has been so, and that is actually the root cause for also the health information systems to be maybe more fragmented than would have been optimal. And therefore, we have been forced to build new overarching national information system parts to compensate for the decentralized original collection and storage of health information. The most important component of the national system is called Kanta, which is a national repository for healthcare, social care and drug prescription data. It is available to professionals and citizens likewise, and it now covers almost entirely our healthcare services, increasingly also the social care services, and it also covers 100% of drug prescriptions these days. There is also a repository site for people's own personal health record information. The Finnish population, generally speaking, is very positive about the digitalization of all kinds of services, probably at least in part because we had the Nokia experience a few years ago. Actually, the Kanta website has been voted to be the second most popular website in Finland. There are about 1.1 million logons every month, and about 10% of the population visit their own patient data repository, MyKanta, every month. Finland has actually ranked many times at the top of different health and also other sector ICT comparisons in Europe. So we have had quite good healthcare data. Modern health research depends on and is based on the availability of high quality data. This idea is one of the reasons why the Finnish government have been endorsing the so-called health sector growth strategy since 2014. The present government is actually the third or fourth in a row that has published strategy documents or roadmaps of how to make Finland a model country of sustainable health innovation activities, public-private partnership, and personalized healthcare, if you so will. The present government, led by Prime Minister Mrs. Sanna Marin, has also recently published the National Roadmap for Research, Development and Innovation, which actually repeats many of the basic principles and fundamentals of the so-called health growth strategy. I would like to highlight the last bullet point here, linking research and development activities to support renewal of the public sector and services. And here I find a very close connection to your new strategy, which emphasizes the benefits to the health and social care delivery that we can expect the research activities to produce. From the very beginning of the history of the health sector growth strategy, it has been a joint venture of the Ministries of Social Affairs and Health, Education and Culture, and Economic Affairs and Employment. And actually, it is not a single, very strictly defined strategy, but it's all about creating an ecosystem of many actors who work together to innovate and create value together. From the point of the healthcare delivery system, we started building centers of excellence, having in mind the fact that, for example, the university hospitals did not cooperate with each other in the best possible way. The relationships between companies and the publicly funded health system were not always smooth. And we wanted to involve the public, the patients, the staff, and make maximum use of the data that is available to all these stakeholders. The first real cornerstone of the ecosystem has been the Finnish biobank network, which was founded by the biobank law already in 2013. They are independent biobanks, mostly owned by university hospitals and universities, but they work together as a cooperative called FINBB, which has also a common web platform where you can find access to the data and sample collections that these biobanks own. Also, the sample collections from the large population studies are now available through the Finnish Biobank Cooperative to investigators, be they academic or industrial. And as you can see, the number of biobank-based studies has been steadily increasing in Finland ever since this system has been in operation. Talking about data, which is very sensitive and personal by nature, we need special legislation to govern its utilization, both in research, innovation activities, and daily patient care. The biobank law was the first, and the next very special piece of legislation is the new Genome Act, which has been around as an initiative for maybe too many years now, but it has been a rough road to go, and we finally hope that we will be able to submit the new Genome Act to the Parliament later this year. The fundamental ideas that are behind this legislation were already written in a working group draft document in 2015. If you are more interested in the difficulties, challenges, but also huge opportunities that genomic data provides, I can recommend the recently published policy brief by the European Observatory on Health Systems and Policies called Regulating the Unknown, a guide to regulating genomics for health policymakers, published just a few weeks ago. We actually continued from the document that was originally written based on the initiatives of the Italian EU presidency, and this theme was one which we wanted to introduce during our presidency during the second half of 2019. The Finnish biobank law has actually been totally updated and is under public consultation right now. One of the reasons has been that from genomic research, the biobanks have received data that has some value to the individuals and to their care providers, but there has been no legally appropriate way to mediate this information to the Kanta patient repository or to the doctor's offices. And so one of the new paragraphs in the biobank law and the forthcoming genomic legislation will be the rules and regulations for handling unexpected observations as well as expected observations from all kinds of studies involving genome analysis. Colleagues, so far I have mostly discussed how the health growth strategy ideology has helped us to be better prepared for the new kinds of information and data that are being generated both in health research and in our everyday life. But we have also realized that we need to improve the infrastructure that delivers the data to our patients and the benefits from the data, as well as enables us to collect up-to-date, relevant data from our patients and health system operations. So one of the cornerstones of the health growth strategy has been to bring together the university hospitals, research institutes, and investigators to clusters of national excellence. And it has not been an easy task, I have to say, because you know that the academic world is very competitive, and realizing that we also have mutual benefits is something new to us all. The first real achievement in this part of the health growth strategy has been the generation of the Finnish Cancer Center, which brings together all cancer hospitals in Finland, is backed by a government decree and a cooperation agreement, and has also received some seed money from the government. We will see how this new flagship will fly, but at least it's now there as an official organization and is supposed to represent the cancer care community and the patients and bring forward the best possible care and to facilitate clinical research in this very rapidly moving area of medicine. Another center of excellence is the Finnish Neurocenter, which is more university-led. The cancer center was more healthcare, university hospital-led, but this is led by academic research institutions, which illustrates quite nicely that not all these centers of excellence need to be similar, but what is fit for purpose is the way to go. And it also highlights how useful it has been that we are 3 different ministries and actually 2 different funding organizations, the Academy of Finland and Business Finland, who form the backbone from the side of the government. This slide shows the current national information systems architecture for health and social welfare. I'm not going to describe it in detail, but more or less the question from now on is that, fine, we have access to data, and it has in a way changed it all already, but what next? how can we make maximum use of all this information? And if you pay attention to the upper right-hand corner of the graph, you also notice that there are apps. People produce information themselves. How are we going to be able to make use of this very valuable information that we so far have not had access to? Legally, the primary and secondary use of personal data are two different entities. To be able to maximally utilize the databases, the registries, and in the future also data collected by individuals, we have installed the so-called legislation for secondary use of health and social data, which has been in action for more than a year now. So from the sources of data collected for primary use, this legislation allows, under strict rules and regulations and safe and data secure procedures, for the secondary use of data based on the Act and operated by a new authority called FinData. The Act defines purposes for the secondary use of health and social data for scientific research, statistics, development and innovations, teaching, knowledge-based management, and last but not least, authorities' steering, supervision, planning, and reporting duties. This slide shows the goals of the new legislation and the new authority, FinData. Eliminating overlapping administrative burden was one of the driving forces of this new legislation. But in fact, over time, it has become more and more evident that we need to improve the quality of the data that has been stored in population study registries as well as in the Kanta patient archive or repository. And this is because even if much of the data is already structured, it is not enough for the purposes of the secondary utilization of these data sources. We need to improve the structured data storage procedures and give instructions even to the practitioners and to administrators about how to collect, how to process, and how to timely store the data in the registries and in the Kanta patient archive repository. Gathering all the operations described in this slide in the hands of the FinData authority has been a major effort, has not been without resistance from the individual registry keepers, not to say a word about academic researchers, but is actually an absolutely necessary thing to do, because this is how we can fulfill the requirements of the GDPR in the secondary use of health and social data. We are aware that there are attempts, legislations, institutions in other EU countries who aim at the same, but it is our understanding that the recently launched joint action towards the European health data space has regarded Finland as a model country and our legislation on the secondary use as a model legislation. And we are very proud that Sitra, the Finnish Innovation Fund, has the honor to be the coordinator of this newly launched and very ambitious joint action. And I'm also happy to notice that Ireland is involved in this joint action. This slide is quite busy, but it tries to illustrate the expected outputs of this joint action. I would like to comment these presumed outputs by saying that one size does not fit all. Countries are not on the same level playing field to begin with, and they need not end up in exactly similar systems, but the systems reflect the healthcare organizations, the funding models, and national culture. But we need to find a minimum common denominator to serve our people so that they can move across the borders as data moves across the borders. And definitely academic research has moved across the borders already for a long time. Towards access to at least 1 million and probably many more sequenced genomes in the EU by 2022 is one of the projects that feeds into the European health data space concept. Probably, and this is my personal view, our ability as ministries and healthcare administrators to engulf genomic information in our databases and healthcare practices is a stress test that shows how well we can follow scientific progress. Genomic medicine, genomic information is there, no question about that. Question is, who owns it, who can make use of it, who can afford it, and who benefits from it? And these are public health issues that need to be tackled together and preferably on the EU level. The current COVID-19 crisis has, of course, been another stress test, both for our health systems and for our research communities. Finland, being a highly digitalized country, adopted the corona contact tracing app Koronavilkku really quickly. About 40% of the population is now actively using it. And so people get positive feedback for digital services. But at the same time, we have realized that our patient record system does not allow up-to-date and timely follow-up of the health system's performance, capacity, personnel, service gaps, and so on. So it has really illustrated that also our system needs improvement. At the same time, we have realized that we are not making maximum use of telemedicine, digitalized services. And I personally think that if, for example, our tax organizations, authorities, businesses have developed digital customer services, why don't we do that in healthcare? There's plenty of room for improvement. And I think that also our patients, our customers, gradually start demanding it. Dear colleagues, in this presentation, I have very briefly and maybe superficially touched upon some of the features of the Finnish health and social care system and the research and innovation ecosystem which builds upon it and is also providing us as healthcare authorities invaluable information and options for growth. You might have wondered why I haven't spoken much about money. The Finnish government has supported the health growth strategy by budget money, which is not horrendously much, but it is very symbolic and necessary seed money for many of the centers of excellence and projects which I have described in this short presentation. But above all, it's a question about how to support and facilitate the generation of regional and national ecosystems. We cannot force them top-down. It is at the same time a bottom-up and a top-down exercise. It's a joint venture of many stakeholders. But from the ministry civil servants' point of view, I cannot underestimate how much I have needed different professionals, medical experts, legal experts, ICT experts in making all this happen, even to that degree that we have been able to achieve so far. It's all about trust between us, stakeholders, the population, but it doesn't really bring us anywhere without the backing support of the government and the necessary legal background. The most important trust is needed. Dear colleagues, this is an old slide that I have been showing for many years, and it still holds true. Data will transform health systems, and the transformation is delivered by medical research and evidence. Building a sustainable ecosystem that delivers is a joint venture. We need to provide the legal and ethical principles, an open, innovative environment for public-private partnership, and we are absolutely dependent as ministries on wide expertise from medical, legal, and ICT experts. We need all your help. It's also very important that we facilitate open interaction and dialogue between the basic science, translational research, clinical science, healthcare provision, and public health experts. I thank you very much for your time and interest in the Finnish system, and I'm very happy to entertain questions. And congratulations and good luck to you in Ireland.
Well, thank you very much indeed, Lisa, Maria. That was a fantastic overview, great overview. It's hard not to be a little bit envious of everything that you've achieved in Finland, but it's really inspiring, and it shows us what we could do. And we actually do have a few questions. I don't know if you're able now to join us, maybe on screen. That's great. And a couple of things that have come through on the chat line. First of all, a question about bringing the public with you. And the question is, how did you bring the public with you on this journey, especially when it came to sharing personal data, personal health and genomic data with commercial bodies?
Yes, now you can hear me.
We can hear you.
Good afternoon, everybody, and greetings from Helsinki. We have minus 17 degrees centigrade and plenty of snow here right now. So it was a good question. I think that one of the keys to success has been that all the processes have been very transparent to our stakeholders, to our healthcare providers, to media. We have invited media to many seminars, and we have had many public hearings, public consultations. And even if we have had some problems with data privacy here in the country, they never really raised the eyebrows of the big public. I think that there is a great trust in authorities in Finland, it's a cultural feature of the country, and we hope that we will we will be worth that trust, and we maintain and treasure it also in the future.
Okay, fantastic. So, but transparency, it sounds like, is a really key feature, really important.
Sure.
Okay, that's great. We have another question that's come in around ethics committees, and the question that's come in is, how are ethics committees structured in Finland in the context of national biobanking efforts, and specifically kind of national multi-site biobank efforts? Are decisions centralized?
No, so far the decisions are mostly regional. We have a network of regional ethics committees, and there is a national ethics committee also. And it depends on the size of the multi-center study, but you need to approach the national or the regional health or ethical committees. Actually, I think that the system is a little bit under transformation right now, and it is going to be more centralized in the future.
Okay, very good. We'll take another one. The great compliments coming in for your presentation. People really enjoyed it. The question here is, were the systems for primary use and secondary use of digital health data developed in parallel?
No. As I tried to describe, it's a long story. how we have developed the system for the primary use of health and social data. So secondary use legislation was actually initiated before the GDPR was around, and the initiative I think came from some academic circles who found it difficult, and it could take a year to get all the permits to combine registry data. The main purpose of that legislation in the very beginning was to facilitate registry-based research. But then when the GDPR came around, so the legislation was rewritten mostly to be fully compatible with the GDPR for many various purposes for the secondary use, not just scientific research. And it went to the Constitutional Committee of the Parliament. It took almost a year, I think, in the Parliament. And then it finally was accepted. And we think it is now fully compatible with the GDPR for the various purposes, secondary use purposes of data that I showed in one of the slides.
Okay, great. We'll just take one more, and it's around industry engagement. Is there a concept of data ownership? How is industry engagement facilitated?
Well, it's a tricky question. I think that of course, we talk to the industry on the central level, but the most important thing is that we have hubs around the university hospitals and the medical universities where the industry is really involved in all kinds of activities based on regional agreements. So as the central government, we don't really have our fingers on that. Thank you.
Okay, Lisa Maria, thank you very much indeed. Now, I know you're going to stay with us and you're going to rejoin us again later on a panel, and so there'll be an opportunity again for people to maybe put some questions to you. I think that there's great interest in what you've done in Finland, so thank you very much indeed for that. Okay, now we're going to move on now to the HRB's 5-year strategy, and a reminder again, please, if you wouldn't mind not sharing slides at this point. We're going to get into a few, we'll get into a bit more details, a bit more meat on the bone after the break. But earlier I prepared for you this overview. HRB's new strategy doesn't actually get launched officially until Tuesday of next week. But as you are all very much our key stakeholders, we're giving you a preview, looking in particular at those aspects of the strategy that you're interested in and that impact you, in particular around funding and building a thriving health research environment. And hopefully many of you will be able to participate next week in the launch as well. Okay, so let's start by looking at the context for the strategy. And of course, we are launching it in the middle of the COVID-19 pandemic. And never before, I suppose, have we demonstrated or seen demonstrated such a clear link between people's health, the capacity of our health and social care system, and the economy. And we've also seen the importance of our public health system, the importance of evidence-based policy, and the need to better integrate research into policy, and how best can our research and academic communities work with policymakers to influence policy, and the role, of course, of scientific advice in shaping public policy. And in fact, this is the theme of a series that's currently being run by the Royal Irish Academy and the Irish Research Council. If you want to check it out, it's very interesting. Of course, we also have Sláinte Care, which sets out a new direction for our health system. That's about reorienting our healthcare system to ensure equitable access. It also recognises that the vast majority of healthcare actually takes place in primary and social care settings. So it's all about moving the focus away from hospitals and towards community-based care. And of course, related to that, we have demographics, the reality of an aging population, which means looking at care models. It means looking at the increase in chronic diseases, for example, and multimorbidity. We also have some very positive developments in the health service. For example, the HSE has a new research governance framework, which hopefully will be signed off shortly, which is very good news. And increasingly, we are seeing, and this is quite a big theme in our strategy, the importance of health and social care data. the way that health and social care data has the potential to transform the way healthcare is delivered, as well as how we manage our own health. And there are plans from the Department of Health for a national health information strategy. Hopefully progress will be made on that this year, and that's all about optimizing the use of data for health. And at European level, one of the priorities for the European Commission is the creation of a European health data space, which again is about sharing data across Europe for better treatment and public health, but also for research. And once you talk about data, then issues of trust are never far behind. We can see the importance of engaging patients and the expectation now that patients and the public will be involved in health research at all different levels, the importance of citizen engagement in research. And we've already seen, I think, with COVID, the great interest that the public has in research advances in relation to treatments, vaccines, and so on. So the question is, can we build on that? Can we build on the support of the public for research? And how can we engage the public better in research and in science? And of course, there are many other developments that we could touch on as well around genomics, personalised care, and personalised prevention. But if we zoom out for a little bit now and just look at the developments more broadly, and particularly around our national research system, because of course health and health research is part of that. And there was a significant development last year with the establishment of a new department, DFERIS. So this is the first time we have a government department that is dedicated to higher education and to research. And this is a great opportunity for a more coordinated approach across the whole health research system, and we are hoping, I think, for a very strong focus with the new department on cooperation and on taking a whole of government approach to research. The first job for the new department, of course, is to develop and implement a successor to the Innovation 2020, which is the national strategy for science and technology for research and innovation in Ireland. That's due to be drafted in the first half of this year and indeed published later in the year. And I think the expectation is that that will be a 7-year plan, then with shorter 3-year work programs. You probably remember last time the Innovation 2020 strategy had a very strong focus on enterprise and industry. I'm sure that will still be there in the new strategy, but hopefully that will be balanced by a stronger focus this time around on research for society and research for public policy. Of course, we're never far away from Brexit. We have to mention that as well. It is a reality. It means focusing much more on East-West relations and indeed on all-island research. Another big development this year is Horizon Europe. Horizon 2020, of course, ended last year. And there's a much bigger budget this year for the EU for Health programme. That's a successor to the public health programme, so you'll be hearing more about that. Other developments, there is the establishment, very welcome establishment of the technological universities we had last year at TU Dublin. And I think this year, Munster Technological University is due to be designated shortly. And there's a real drive across the whole system towards open science and open research, and issues like research integrity taking central stage. And I suppose overall there is a need, and I think in a growing acknowledgement of the need to increase the overall national investment in research. And if you just take a look at this slide, you will see that government investment in research as a proportion of total government spend is now less than about 0.9%. And if you look over on the right-hand side there of that picture, you'll see that Ireland is one of the poorest performers in the EU and well below EU average. So that's a kind of a joint or a shared responsibility, if you like, for all of us in Ireland and for public policy to try and increase the overall investment in research in Ireland. And we're looking forward to working with the new department to try and make some progress on that. Okay, let's go back to the HRB strategy and talk about that. It's against that context, I suppose, all of those developments that I just mentioned and more, that we started to develop our strategy over a year ago. In fact, we had quite a bit of it done before the COVID crisis struck. Certainly we had done the stakeholder, internal and external stakeholder engagement, and we'd also convened an international expert panel as well. And out of those, there were a number of emerging themes and potential themes. And we then put that through a sort of an iterative process, I suppose, between ourselves and the HRB, our own board, Department of Health, to shape that and to identify a number of strategic objectives and key actions, and of course an associated work program as well. I think in total we had about 400 different inputs to the strategy process. So it was a long process, but it was very thorough, and I think it was a very good process. And I suppose, as with all strategies, it's an opportunity not just to identify the key actions and objectives for the years ahead, but also to refresh our vision and mission, and to think again about the values that underpin our work. And so, setting it out here on this slide, you can see our vision for the next 5 years as being better health through excellent research, data and evidence. And what we're here to do, and what the HRB is here to do, is to support research that improves people's health, promotes evidence-informed care, and creates solutions to societal challenges. And I think above all, that vision and that mission reflects the unique position that the HRB is in as a mission-oriented agency. It's all about health, but positioned at the interface of the academic and the health systems. And I think that's a particular strength of the HRB. So to get there and to realise this mission, this vision and mission, we have set out 6 interlinked and mutually supportive objectives. And most importantly, I think we want to be clear that at the heart of this strategy, we are putting the voice of the public, of patients and carers. And that's very much because public trust and confidence are absolutely essential for health research, as you will know. The HRB has already led the way in Ireland in public and patient involvement in research, and we're absolutely committed to continuing that and indeed developing that further over the next few years. Okay, so let's take a look at these objectives, first of all, starting with the first one. The first one is around our funding aims, or at least a significant part of our funding aims. It's about investing in research that delivers value for health, the health system, society and the economy. And we have shortened that, in other words, to research that makes a difference, funding that makes a difference. What do we mean by that? Well, we're aiming here for stronger collaboration, coordination and prioritisation, particularly stronger collaboration and coordination across the health system, and looking at the integration between the health system and the academic system. We are looking at a balanced funding portfolio, so that is research that informs decisions and actions in the health and social care system, but importantly also a continued commitment to high quality investigator-initiated research that has value for society and the economy. We are looking to an investment that involves, as I said before, public, patients and carers in different aspects of HRB funded research. And we are very interested in the way we fund, looking at the way we fund, making sure that we are meeting best international practice and indeed in some cases leading practice. So we're looking at excellence in health research practices, and we're looking at measuring the return on investment and demonstrating impact, the impact of the work we fund. Moving on to the second objective, we aim to be an independent, credible voice for research and evidence and a trusted thought leader, an independent voice for health research. So what do we mean here? We are setting out to achieve a structured and a coordinated approach to evidence synthesis. Some of you will be familiar with the fact that the HRB, we have our own evidence centre in the HRB that provides an evidence service to the Department of Health. We also fund other evidence supports throughout the system, and so we want to make sure that all of that work is structured and coordinated at national level. And a very big drive to make sure that Ireland has the capacity to support evidence-based policymaking in health and social care. And what we're trying to get to here is to see research and evidence embedded in key decisions for health and care services and underpinning health strategies. And what that means as well is raising the level of knowledge and raising the level of awareness of the importance of evidence synthesis at all different levels. And overall, we are aiming in the HRB to be a trusted and an objective source for health research and evidence and data. The third objective we set out for ourselves is to promote and enable the use of data to shape health policy, to enhance healthcare delivery and drive broader research and innovation initiatives. So this is all about trusted data. This is a very big agenda. It's an important agenda, obviously, as I've said before. What we're aiming for here is to see national and applied data infrastructure that supports research for health, social care and well-being. There's also a number of, I mentioned before, a number of initiatives going on at EU level, particularly around European health data space. We want to be an active partner in those initiatives. We have, again, some of you will know, and you've probably worked with our own national health information systems here in the HRB, very much focused in the areas of drugs, disability and mental health. And we want to see our own national health information systems supporting policy planning, service delivery and, very importantly, research. We want to see HRB data and evidence inform the implementation of the national drugs and alcohol strategies, because they are areas of expertise within the HRB. Very importantly, we want to see that patients, members of the public, researchers and policymakers all have confidence in the way that health data are used for research. This is really, really important. It goes to the heart of health research and having a good health research system. And we want to see health research and data in Ireland being open and fair. Our fourth objective is all around the environment for health research in Ireland, and we've done quite a bit of work on this already, and we're going to continue and expand this in the next 5 years. So we are aiming here to build a strong and supportive environment for health research in Ireland, and that's about developing a thriving research environment. This is about the people and it's about the infrastructure. So first of all, looking at the people, we want to invest strategically in research leadership and also in capacity. And that's in the people and the talent. We can't go anywhere if we don't invest in talent. It's so important to invest in people. And so we will be continuing our support for training programs and research fellowships at all different levels using our health research career framework. We want to invest in a coordinated clinical trials infrastructure, very importantly, one that is integrated into the health system. And over the next 5 years, we see further integration taking place into the health system so that it's not just seen as something that's the responsibility of the HRB. We want to make progress on national shared high-cost research infrastructures. And what do we mean by that? We mean, for example, in areas like biobanking and genomics research. And this is something we really, really need to make progress on as a matter of urgency in Ireland, but it is very much something that the HRB cannot do on its own. We have to work with others to do that and to put those infrastructures in place. We've already started transforming the national research ethics system in Ireland through the establishment of the national office in the HRB for NRETS, and we want to continue to lead the transformation of the national research ethics system. And we want to develop and shape health research related policies, regulations and procedures and look at their implementation in Ireland. Our fifth objective is around collaboration. This is a huge area of the HRB, really important area, and particularly around European and international coordination, collaboration and engagement. I think we have seen that there are some things that you just have to do in collaboration with partners, and it's really, really important to put those structures and systems in place. So this is all about productive international partnerships. So we will continue and expand our role partnering in EU and international health research and policy projects, particularly those that address priority challenges. I mentioned earlier the establishment of, or the launch, I suppose, of Horizon Europe. We will, in the HRB, aim to have an expert understanding of that landscape. We, I think, made a very big contribution to Horizon Europe, or sorry, to Horizon 2020. And we will continue to do that for Horizon Europe. And we're aiming here to use systematic horizon scanning and certainly engage with key stakeholders. We want to see the Irish health research community and policymakers compete successfully in Horizon Europe and, importantly, in the EU for Health programme, and we'll be putting structures in place to try and do that, and also, of course, working across the system with other funders and other government departments.
And very importantly as well, we want to engage with and contribute to the aims of the 2030 Agenda for Sustainable Development. So that's looking beyond Europe and looking at our responsibilities as a funder, and indeed our responsibilities as a research community to that agenda. Finally, I just wanted to mention the last objective, which is a more internally focused one, but it is an important one as well, and one that you will interact with. It's all about developing the HRB as an organisation, as a progressive place to work, and supporting the people in the HRB to be innovative and responsive. So in other words, it's about organisational excellence. We want to promote a positive organisational culture. We're aiming for high standards in our corporate governance. It's very important because we are funded by the taxpayer to deliver value for money and obviously optimise our financial operations. We're very heavily reliant on ICT, so we want reliable, resilient ICT systems that are cyber secure and focused on digital innovation. And as an organisation, we have our own responsibilities around climate, so we want to set out to deliver on ambitious sustainability and climate action goals. And finally, of course, we will be working, as always, to enhance communications both internally and externally with the community. I just want to say a few words at this point and finish by saying a few words around values, because, of course, how we work is just as important as what we do. We see the HRB as leaders in terms of raising the standards of health and social care research and evidence and data nationally. We very much see ourselves as an independent and trusted voice. We want to be an independent and trusted voice for research evidence in health and social care. We want to stress our accountability. We're accountable for the research we fund, the research we do in-house, and the data that we manage. And we are committed to quality standards. And we want very much as an organisation to be agile and innovative in how we respond to the research needs of society and the health system. And as I mentioned before, a huge part of our work is around collaboration nationally and internationally. A lot of the things that we want to do can only be done in collaboration, whether it's with the health system or with other funders, or indeed with yourselves in the research community. So we'll be putting a very, very big focus on that. And finally, we aim to be inclusive. We want to engage positively with a diverse range of people. And as I said earlier, make sure that we put people, patients, and carers at the heart of everything we do. Thank you.
Okay, and a reminder to submit any questions you may have in the live Q&A on your screen, and we'll try to answer them at the panel session later on. So now we're going to take a short break, and when we come back, we'll go into a little bit more detail and look at some of the practical steps we're going to take to advance the HRB strategic agenda. So we'll see you back here at 4:15, 4:15. Welcome back, everybody. So earlier on the first session, you heard about developments in Finland in relation to data infrastructure, and we gave you a brief overview of our new strategy. So next up, we're going to hear 3 presentations from members of the HRB team, all of whom will be very familiar to you. And that's Anna Cody, Maura Heine, and Therese Maguire. So Anna's going to start off, and just to let you know, Anna, of course, you will know very well and was head of our pre-award team during the last strategy here in the HRB. This time around, and for the next 5 years, Anna is going to head up investigator-led grants, research careers, and enablers. So I'm going to hand over now to Anna, who's going to give you a brief update.
Hi, my name is Anna Cody, and under the restructuring that followed the new strategy that you've just heard about, I am now the head of research, investigator-led grants, research careers and enablers. And I would like to share some thoughts that we've had so far in this space with you. So to start out, I'd like to say that most of the schemes that are aimed at investigators and career development will continue. You will see a lot of familiar formats over the coming years. However, we will, of course, adapt them somewhat to sit very comfortably within our new strategy. In addition, we will have new and targeted opportunities in collaboration with the Department of Health and the HSE and other stakeholders. My colleagues, Maura Heine and Therese Maguire, will tell you more about those, and these are not covered in my slides now. We will also continue participation in EU funding opportunities. In fact, we do hope to strengthen our engagement in EU initiatives over the coming years. So, where are we now? At the moment, we have 5 calls open, which all happen to be with funding partners. 3 of them are EU calls. One of them is the ongoing partnership with the Wellcome Trust. And the final, last not least, one is about research exchange visits with France, jointly with the IRC under the banner of Ulysses. We also are working on 8 calls where applications have closed and where we are at different points of processing of applications and coming towards a funding decision. Now, this is what you presumably all wanted to see, which are the new calls to open in 2021. We will start out with a new call for the investigator-led awards in spring. And we hope to get a good response to that. We will also open the next round of the investigator-led projects, and it looks likely that the timing for those awards will be slightly different from previous rounds, where we would have opened them in August. We are now looking to open them in late June, early July, and keep them open into September, so throughout the summer and a little bit beyond. We are also planning for a new round of the Applied Partnership Awards, where we're aiming to bring together researchers and knowledge users, and the research collaboration for quality and patient safety that we do jointly with the HSE is also going to run again. The conference and event sponsorship scheme had been put on hold last year because of the very limited need to support physical events and conferences. We hope to be able to put it out again in Q3 of this year, but obviously we'll keep the situation under review and look at the public health situation before we come to a final decision there. We are entering the 11th round of the joint funding scheme with the health research charities in Ireland, and we would hope to have documentation and all that finished from our side late in the year, in Q4, and but bear in mind that it's the participating charities that actually open the calls, so you would expect staggered opening times depending on the charity between maybe November and January or so. The secondary data analysis projects were very well received when we opened them first in the previous round, and we do hope to keep doing those, in particular sort of highlighting the importance of secondary data and data in general in the HRB strategy and for health research. And we also hope to have another intake of the HRB postdoctoral interns to train them in all things research funding, but also to give them opportunities to work in the HRB Evidence Centre and in the HRB held National Health Information Systems, to give them a really broad experience. And certainly our experience with these guys has been fabulous. They're very, very good, and hopefully they get a lot from it. Just a little caveat that obviously all calls before we go out to them need to be approved by the board. So that's as it always has been, but there may be sort of small tweaks to that calendar. We've also been thinking about the pipeline of calls to open in 2022, and we're likely to start off the year with the 2 postdoctoral awards, the Applying Research into Policy and Practice for academic researchers and the Clinician Scientist Fellows for health professionals. There are always a variety of EU calls that start out early in the year. We don't have the details of this yet, but we expect to participate. And personally, I'm particularly looking forward to a new round of the Knowledge Exchange and Dissemination Scheme. They are really good at adding value to existing awards, and we would hope to open them again when the opportunities for a knowledge exchange have actually increased and become better again. The Definitive Intervention and Feasibility Awards would be on the calendar again for 2022. This is obviously important in the context of health research and also in the context of the significant investment we are making into clinical research infrastructure. And we have not had new Clinician Scientists Awards, the most senior level of career support for health practitioners in a while, and we do hope to go out with that call in 2022. 2 related topics that I'd like to mention. One of them is what we've been doing around public and patient involvement in research, or PPI for short. PPI is emphasized a lot more in our current strategy than it was in the 2016 strategy, and that reflects that we actually know a lot better what we want to do there at this point, and also the leadership role that the HRB has taken up in this space over the last 5 years. Happily, I can say that the PPI Ignite network will start up now in March. This builds on the previous PPI Ignite awards in 5 universities, but it now includes 7 lead sites. It includes 10 national partners and 54 local partners, so it's really grown into a very substantial network. We also plan to go out soon with another survey to inform what else the HRB might do to support PPI. You might remember that we did a survey in 2016, and out of that arose PPI Ignite, our emphasis on budgeting for PPI and a number of other things. And it's time to refresh that. So I would ask you all really to think about what you would find the most useful support that the HRB could provide. And we also want to take stock of the quality of PPI sections in applications. We started including a question in application forms in 2014. and we want to compare that versus some of the most recent crops of applications. And my gut feeling is that a lot has changed in the meantime based on work that not only we have done, but also many others in the country and in the system. But I'd like to see evidence of that as well. And that leads neatly into our thoughts about research on research. We have a long history of continuous improvement, but that's typically been based on experience and expertise, and we want to get more systematic about the evidence base for some of our practices. We are currently involved in some projects of that nature, internally or externally led, and we will develop a more formal approach over the next year or so. But if you do have a burning research on research question in the meantime where you would like HRB data or input, let us know, and we'll do what we can in the meantime. And that's where I would leave it for now, and I'd hand you over to my colleagues.
Thanks very much indeed, Anna. And many of you will know that Anna has led the way in Ireland in the whole PPI agenda, and it's great that Anna's going to continue to lead out on that particular area in the new strategy. We've already got a topic, by the way, for our research on research, because somebody has asked a question about, is there any way that we could reduce the administrative burden on people when they're applying for grants? And we have a lot of sympathy with that question, I can tell you. So maybe that is something that we could look at through our research on research programme. Okay, so next up, my colleague, Dr. Maura Heine, and again, Maura will be well known to you all, and in the last strategy period, Maura looked after our post-award and evaluation team, and she will continue with some of that in the next few years, but this time around, she is taking on responsibility for international cooperation, evaluation and targeted programmes. So over to you, Maura.
Good afternoon. I'd like to talk to you about the target of initiatives that the HRB is already investing in and would like to continue to invest in that guide health and social care decision making. We've already invested a lot in this area. Teresa will talk to you about research infrastructures and data infrastructure that we already support and will plan to continue to support. Anna has already discussed with you the training programs and the investigator-led initiatives that we already plan, and I would like to talk to you about those initiatives that sit within health system and health policy. I want to talk in particular about how the HRB was just to move forward in supporting the evidence ecosystem, that cluster of activities and contexts that link evidence with uptake and translation in policy and practice decisions. On the right-hand side of the screen there is a really important step, which is the synthesis of primary evidence. And this is really key to informing prioritization, methods, and primary research. It encourages the quality and completeness of execution and reporting of research. It avoids duplication and research waste. And so it's a critical component of the evidence ecosystem. The HRB occupies a unique space at the interface of health and academic systems and has invested in supporting initiatives right across the research ecosystem. On the evidence synthesis side, it has provided access to the Cochrane Library for many years. It supports Evidence Synthesis Ireland to build capacity and awareness of the importance of evidence synthesis and also in undertaking evidence synthesis. And it has supported HRB CISR to develop evidence-based clinical guidelines. So what of the future? What do we plan to do? Well, firstly, we want to look at evidence synthesis more broadly, informed by international evidence synthesis and evidence mapping initiatives. The HRB is already involved in international evidence mapping and synthesis initiatives such as the Cochrane Library, COVID collections, COVID NMA, and evidence aid. In relation to COVID-19, HRB has supported the generation, updating and knowledge translation of evidence briefs, rapid reviews and systematic reviews in WHO guidelines through the work of the HRB Evidence Centre, the National Drugs Library and Evidence Synthesis Ireland. We want to build on these past investments in Cochrane Library and training, CISR, ESRI, ESI, etc. And we will continue to enhance our relationships with the Northern Ireland HSC R&D division to build evidence synthesis capacity and activities on an all-island basis. But evidence synthesis is only one part of the evidence ecosystem. There's an increasing appetite within the health system to harness research to address organisational and healthcare delivery challenges. HSE is invested in co-design and engagement with key decision makers through such schemes as the Applied Partnerships Award and the Research Collaboration for Quality and Patient Safety. We have also responded to specific healthcare evidence needs of the department, such as the framework for staffing and skills mix for nurses and the mother and baby homes initiatives looking at the health care needs of survivors of the mother and baby homes. And this has been informed by the work of TILDAS. So investment in longitudinal studies is a really good example of how we can leverage our investment to address evidence gaps. We've seen dividends in investing in initiatives in the past, so we want to continue to invest in co-designed research such as the APPES and the RCQPS schemes and build on the growing willingness and trust of both researchers and decision makers to work with each other. The Department of Health has found this kind of engagement invaluable, so we want to increase our efforts to engage with key stakeholders and put a better structure on our engagement with them to harness value into the future. We also see opportunities to build unique, flexible, policy-driven initiatives that can align with the constantly evolving policy agenda of our partners. In doing so, it will be important to stay connected and abreast of international developments and learning. And there are some great examples of policy research programs internationally. For example, the Clark collaborations between clinicians and decision makers in the UK. The HRB has also built up considerable knowledge of the European research landscape and of engaging with key stakeholders at European level. And this has had benefits for both us and our research community. And we will continue to raise awareness and facilitate participation where appropriate for researchers, organisations, the HRB and the Department of Health. We have supported health researchers to participate in Framework 7 and Horizon 2020, and will continue to do so in Horizon Europe, which will have a budget for health of approximately 7.7 billion. We are also supporting Irish researchers to become involved in joint programming initiatives such as JPND, Healthy Diet for a Healthy Life, and Anna has mentioned more recent involvements that we're engaged in, and we will continue to seek opportunities where appropriate to engage in new EU partnerships, but also in partnerships beyond the EU. Finally, I'd like to draw your attention to the new EU for Health programme. This is almost 10 times larger than the previous public health programme, with a budget of 5.1 billion over the lifetime of Horizon Europe, so of 7 years. So that's up from 500 million in the previous programme. Legislation for the 2021 to 27 programme still has to be formally adopted, and this should be done by March or April. And following this, the Commission will put forward a detailed work programme for 2021. The scope of the programme is hugely expanded in order to address the weaknesses of the European health systems that became, and supply chains that became really apparent during the pandemic. And the Department of Health and the HSE are obviously both very interested in the potential of this programme to improve their service delivery. The HRB is committed to helping Irish health researchers to engage with this applied programme through its role as the national focal point for health. And we see a lot of opportunities in many applied areas, including implementation science, health policy, health system research, health promotion, and so on. So I'd really encourage you to look at this programme. Thank you.
Thanks very much indeed, Maura, for setting that out. It's a really exciting and challenging programme of work for the HRB in the years ahead. Okay, so coming up now, and in last but not least, we have Dr. Therese Maguire. And just to remind you, of course, Teresa came back to the HRB after a period of time, a number of years in the Department of Health. We're absolutely delighted to welcome her back to the HRB as the new Director of Research, Strategy and Funding. But for the next 10 minutes or so, Teresa is going to tell us about our plans around health research and data infrastructure. So over to you, Teresa.
Good afternoon, everyone. Delighted to be here this afternoon to say a little bit more on our strategy for the next 5 years, and for something a little different from what we've talked about so far with Anna and Maura. I'd like to say a little bit about our thoughts on health research and data infrastructures. And I suppose I'm going to start and run pretty quickly through an area that you probably think about most when you think about the HRB and infrastructural support, and that is, of course, an area of long-standing and significant now investment over the last decade or so, where we have invested in facilities on the campuses of hospitals for the conduct of trials and intervention studies, support services, clinical trials networks, methodology support, funding for trials, etc., etc. Over 100 million over the course of the last decade or so. And you'll know that we published a report with a deep dive review of that collective investment in 2018 that had a number of recommendations in that for taking that one step further. And it therefore won't come as a surprise that you know that in this strategy we'll continue to invest in this space. Indeed, the next 3 to 6 months, a number of calls have closed and applications are in on our desk currently, and we have some strategic choices that we will need to make in relation to that. But clearly we want to increase the volume of trials, both commercial, and we want to see growth in our investigator-led trials, the diversity of trials, the quality and the efficiency of trials, and ultimately the impact for patients of this trial infrastructure in the country, and importantly increasing our international reputation and on the international stage, where we can readily compete in collaborative multi-centre trials. So what are the types of things that we're looking at in that regard in relation to our trials infrastructure? Well, I mentioned strategic choices, and I suppose it won't come as any surprise if we want to move gradually on our journey to those metrics of more diversity, better quality of trials and so on. We'll be looking for initiatives and centres and networks that are ambitious to our common goals, can perform well across a new metrics framework that we are developing with the advice of a strategic advisory board to the HRB. So that's an important development. We're increasingly looking for stakeholder commitment, both from the clinical, the academic and commercial partners into this endeavour, including co-investment and cost sharing, but not limited to that. And I suppose we're looking for applications which are future oriented, as well as doing the work before us today. So those who are looking around corners, who are already thinking ahead in terms of potential funding streams in Europe through the new EU for Health Partnership, linking into EU platform trials, thinking about value-based healthcare and the merging of real-world data with clinical trial data, thinking about trials in intervention studies out into the community, thinking about cell and gene-based therapies and the whole move to advanced therapeutics. What does that mean for our clinical trials infrastructure, our capacity building for our future? And ultimately, in a small country, entities that can deliver in their own right for their own institutions and for their own areas, but fundamentally can be integrated and coordinated strategically and operationally to ensure that the sum of the parts is greater than those individual parts. The second area that I want to touch on today is again one where you can see the discourse and the dialogue in Ireland growing. And it really builds on recent decades of transformation that we've had as a result of omics, advanced machine learning, high performance computing, the move to cloud computing, really sophisticated imaging methods and so on. And all the opportunities, on the one hand, that throws up for prevention, diagnosis, treatment and care, but of course the complexities and the challenges of trying to mine all of that information from many sources and actually turn it into actionable knowledge. So really exciting area, an area that the HRB has been increasingly getting involved in, these international alliances and consortia to try and navigate this space. For example, the ICPERMED, the HRB is participating in that. We're involved in the EJP in rare diseases. We're linked in already, obviously, with ECRIN in ESFRI, but we're looking at other research infrastructures like Elixir and like EATRIS and BBMRI in that regard. And we're observers currently on the 1 Million Genomes project that Lisa Maria mentioned earlier. And I suppose really a job of work for us in this strategy is to figure out the so what for Ireland and so what for the HRB. What and where should we, as a HRB community and the HRB itself, working with the Department of Health, because the interface between the academic and the clinical system is absolutely critical here. Where can we add most value? And we also know that there are other partners in Ireland, like SFI, IDA, NEI, who are very interested in precision medicine, as they call it. And, you know, what can we do together? Is there an intersectoral vision or strategy? And can each of us play a part in terms of taking us forward there? And I think we have a critical role to play as a community where we are in that space between the health policy, the health delivery and the academic systems, and with a very significant public, patient and citizen engagement footprint. And I think that is going to be important, because before I move off this point, I suppose there is a tendency for people to think of those who are in omics and informaticians and computer scientists and so on, and the infrastructure and the platforms around this. But it's also important for our wider grant holder community, because issues come up here in terms of, like I said, what does it mean for clinical trial design and compliance with GCP? Data, again, optimal collection and use of health data, absolutely significant here. Health economists and social scientists will have questions arising from this in terms of equity, in terms of transparency, in terms of inclusion of the patient voice in this dialogue. And it also throws up of lots of issues that we really haven't grappled with in any sort of meaningful or sophisticated way in this country, around the role between the public sector and the private sector. So we do need to get into discussions around new business models and so on. So I think a lot in there of interest to our broad-based community. The third and final issue that I just want to say a little bit about, I couldn't resist it. I just want to follow along the lines that Lisa Maria presented to us earlier, and selfishly, that's a large part of the reason why we really asked her to participate in this grant holders conference, because we just see this as being absolutely a huge and critical area that is optimising the use of health and social care data for research purposes. And I'm not going to labour the point, because you'll have seen a version of this in Lisa Maria's slide, but we have to find a way of securely and safely and transparently accessing this data and for many secondary uses, not limited to, but we are looking for it to be accessible for research and innovation purposes. This is just increasingly critical. You've seen it in the discussion on trials. You've seen it in the discussion on omics. If you're a health services researcher, you're limited by access to sort of patient level details for workforce data, for claims data, for pharmacy data. If you're a population health researcher, you really want to look at geospatial data, data from wearable devices, survey data, registry data, etc., etc. So this is absolutely critical, and this really is where we believe, we need an Ireland vision for how we're going to take this forward. We're clear that the HRB can't take this forward alone. However, we have a lot to offer in this space. We've previously published vision, the DAZZLE model a number of years back, for data access, sharing and linkage. And we've taken that one step further, and we've actually got a proof of concept study underway at the moment with iCheck, looking at the technical architecture and interoperability issues, and showing the art of the possible, albeit with dummy data. On the back of this and building, I suppose, on the needs through COVID, we're soon to launch a mechanism in partnership with the CSO and the department to provide access to the COVID-19 data hub for research purposes. You'll hear a little bit about that in the next number of weeks, and a lot more detail. And we just think this is a huge step and a flagship project for a potential way forward. We've also learned a lot from our prior experiences of secondary data analysis projects that we've funded, even without these mechanisms, and we really want to do more in this space. We've leaned into a lot of really, really timely, critical initiatives in a European context. We're participating with the department in a PIRI for COVID, which is a population health infrastructure, looking at sharing of population health data into the future, and an infrastructure to do that in a safe way. And we've been involved in discussions around fair data and open data more generally. You'll be very familiar with our involvement in that. And we know that other countries have done this, like FinData, like the Estonians, like the French Data Hub, and so on, across the UK. And we're really excited to be participating in this new initiative, started on the 1st of February, towards a European health data space, which is really Europe's way of saying, this is where we're moving, and you're with us or you're not with us. So I'm delighted to say that we are working alongside the department, and hopefully others in due course, on this initiative. And what does that mean? Well, it means that we'll be learning, harnessing the collective learning and the wisdom of people who have been there, who have done that. And yes, that group is looking at how to share these data and so on across Europe. But we've so much to learn in terms of how we can get our act together nationally in order to play in this arena, whether it be architecture and portals, whether it be governance and access rules, training needs for both the providers and the users, regulatory frameworks, a huge programme of work going on to look at harmonisation of the interpretation across Europe, and a code of conduct for sharing of data. And of course, no conversation in this area would be complete without talking about citizen engagement, participation, and data altruism. So this will give us a way forward. There will be no excuse. It's like DAZZLE to the power of 1,000 by way of information and evidence and a way forward. And so the challenge is to harness all of that, connect us and you into that as much as possible, and to try and influence our national agenda. Our health information system strategy, long overdue, hopefully will be prioritised in the Department of Health's work in the year ahead. We have a public service data strategy, which is quite interesting and could be a catalyst to support some of this work, and I think it is important. We haven't typically spoken between the R&I sector and deeper in the past. I think we need to do that, and we have an opportunity to influence the agendas of both the refresh of Innovation 2020, the new government department with responsibility for innovation, science and higher education. We have a national development plan where something really, really meaningful could be done and be a step change for this space in this country if many parties are to come together. So I think, I hope I've convinced you that these are actually very interconnected areas throughout our strategy. Really important that we play a leadership role in brokering with the department, with other government partners, and that we bring you on that journey, and we will need you all the way on that journey to enact a new future for data, for health research in Ireland. Looking forward to the discussion and to questions later on. Thank you.
Thanks very much indeed, Teresa, and indeed to Anna and Maura earlier. Okay, now we're going to move on to our Q&A session. And so I'm going to invite back on screen all of our speakers this afternoon. That's Lisa Maria, Teresa, Anna, and Maura, and I'll join you as well. And I'm pleased also to introduce our moderator for the session, Dr. Maurice Houston, who is Professor of Medical Humanities in Trinity College Dublin and a columnist. So Maurice, over to you.
Thanks very much, Mairead, and on your behalf, hello everybody, and on your behalf, maybe could I thank the 5 speakers for some excellent contributions. I'm going to start off with a question that's come in for Lisa Maria, and it's this: in relation to funding models and sustainability of large infrastructures like biobanking, how long does seed funding last in Finland?
Thank you very much. That's a very good question. So typically, the seed money is provided for 3 to 5 years, and then these new networks, infrastructures, organizations have been supposed to be financially independent, so to say. Well, actually, over the years, we have realized that many of these are actually national infrastructures, and some of them are even authorities that are exerting public power actions. So they should actually be considered as public infrastructures and be continuously funded from the state budget. And I think that FinData is an excellent example of this kind of a development. The purpose, of course, is to try to keep the user fees as low as possible. Thank you.
There's a follow-up question to that, which you may have touched on, but how instrumental was the initial investment in a biobanking infrastructure to realising the vision of the entire initiative and national policy in Finland?
Well, I think it was quite important, but I also want to emphasize that the biobanks are owned by the hospital districts, which are funded by tax money, and universities which are funded from the state budget through the Ministry of Education and Culture. So there is a whole lot of public money around, but then this symbolic seed money for them to cooperate better with each other, I think that was a very important thing, even if it was money-wise, not that much. But it was earmarked, so to say, to increase their cooperation. Thank you.
Thank you. Murray, you referred to this a little earlier on, but so maybe you can guide me on this. But it's the most popular question that's come in for the afternoon, and it's: the strategy looks great. How can you reduce burden on researchers in terms of the huge amount of work going into grant applications? And I know you refer to the fact that would be the basis of a further session, but is it something that you wanted, you and others wish to tackle now?
It's a very, I think it's a very good question actually, and I think what's happened over the years as we've become, the demands have increased. There's no doubt about it. We expect more and more, and it's a lot of it is around professionalising research, and the fact that we do need data management plans now, and of course we want to see the PPI component, and there's lots of different angles to the whole thing. And if you're taking on a student or if it involves any training at all, we want to see proper training plans, and it's all very sensible and everything there is very sensible. But we absolutely understand that when you put it all together, the forms are getting longer and longer and longer. So I guess this is something probably that all I imagine that all funding agencies are kind of insisting on, probably, or a lot of them anyway, and it is undoubtedly a burden on the research community. So it is something we should probably look at. I was thinking about it just as Anna was speaking in the context of this, this idea that we would set aside a small amount of funding for research, and that's the sort of thing we mean. It's like, how can we improve our own practices better, and what can we do to make sure that we have an evidence-informed approach to the way we run our business, if you like. So it might be an interesting one to look at, and maybe even to liaise with other funders on. But I don't know if any of my colleagues probably would have a better sense of this even than I have. I don't know. Maura or Anna, Anna, I'm sure I can't see her at the moment, but if either of you have a comment to make on that.
Yeah, I mean, unfortunately, there are policy drivers that we do have to take into account in our research and our research applications. And so I suppose as we've become more sophisticated in thinking about policy drivers and behaviour of researchers, you know, in terms of good research practices and data management and so on and so forth, it is making the forms longer. I don't know how you can, I mean, you can't just throw those things out for the sake of a short form. But I think it's perhaps more about trying to streamline those. You know, it might be interesting to look at how we might streamline those sections in some ways, that people could perhaps put their intent or their ambitions and plans for these areas somewhere else that we could link to. Or I don't know. I mean, obviously we have to do the research first. I mean, I'm sure there are things we could do to ease the burden a little bit, but without throwing the baby out with the bathwater. I mean, I think that's important too.
I think, I mean, there are some moves. For example, some UK funders have just moved to like 2-page applications, which is a little bit extreme maybe, but because you're just getting very little information in 2 pages. And, you know, Mairead mentioned earlier that we are accountable. We're not in the business of just taking pot shots. We want to have quite educated guesses as to where we put our money. And yeah, there is a balance to be struck between the burden that's put on applicants, also on reviewers. You know, that it takes a lot of time to review all those, and what's the additional value that can be gleaned there. But I do take it. It's something we need to look at.
Are you done? Yeah. Yeah. Okay. I really like this next question. It's almost like something a journalist would ask, but I promise I didn't come up with it myself. Ian Kelleher asks, how do you get electronic healthcare records high on the political agenda? Far ahead.
I might attempt to give some sort of I won't say an answer, but maybe some commentary on that. Probably mostly, if I'm honest, not necessarily with my reflection from the HRB, but from my time in the department where this was a live issue. I don't think it's low on the political agenda. I actually think we have a vision and an implementation deficit. If I'm honest, I'll possibly be shocked by numerous individuals for saying that. And what do I mean by that? I don't mean that at an individual level. I do think we have tended to, try to navigate this landscape project by project and incrementally. And that is really not going to get us very far. It might well make a difference in a hospital, in a particular section of a hospital, etc. But it's not going to take us. And I was very struck by the way Finland and Lisa Maria's presentation talked about a vision. Now, you may never do it in the time that you set out, and you may not end up exactly with what you started, but you have a vision. And so I think, we haven't cracked it yet. It was thought that perhaps layered in under Sláinte Care would be the way to take it within that bigger picture and the vision and so on. Little steps, and I would be aware probably more than the public, very positive steps that have been made in that respect. But it's very piecemeal and it's very fragmented. And the other point to that is it's not a funding deficit. I would say there's definitely a capacity deficit. The same people who are trying to work with the fragmented data systems and architecture to get us through COVID are the same people who are supposed to be technically and otherwise taking us to this new horizon, and that's not going to work. So if I had I suppose a wish in the morning, it would be very similar again to what Lisa Maria described earlier. You need a team of government, with legal and legislative people. If you almost follow the types of issues that arise in this that are coming up in towards the European health data space, I love their work package. It almost sets out a way forward for these issues. You've got your architectural issues, you've got your technical and your interoperability issues, you've got your legal and your GDPR issues, you've got your ethical issues, you've got your citizen engagement and your outreach issues. And all of those people, not just technical people, and not just people waiting to release funding, but that complementary team who this is their every living, waking hour. And I think there is an opportunity to take the e-health agenda forward, linked to a refresh of the National Health Information Strategy. And doing that now, the benefit of being late to the table, doing that now with secondary use purposes in mind. Do it once and use it often. We have that ability to look around the corners because others have been there before us and told us what worked and didn't work. So that's just my own reflection on it. It's not a funding deficit. It's not a lack of political will, but somewhere in between, something isn't working. Anyway, for what it's worth, that's my view.
Where's you muted?
Sorry, I had unmuted myself. I'm not sure how much of that you heard, but basically to say that it's a well-made point about the fact that people who might make these decisions have their plates extremely full at the moment with the pandemic, and it's an interesting, we talk about heart disease and cancer and worry about those patients not being seen, but this is yet another example of the pandemic interfering, if you like. Does anyone else want to come in on that? I'm just wondering, Lisa Maria, do you want to come in from a Finnish perspective, a different political environment, obviously?
Yeah, thank you. I wrote some thoughts. I mean, you need incentives. And what are the incentives of our patients, our customers, our people? I think that people want to see their healthcare records. They want to have access to the information. And that's the main driver, I think. If you think about the practitioners of healthcare professionals, I think they are really interested in the quality of their care. And being able to get some feedback from your actions, some peer review data, and all that stuff. That's the incentive for healthcare practitioners to really take the time and effort to write, structured data down. They won't do that unless they have a pretty short feedback loop of benefit of the work that they have done to create the information. And then from the healthcare organizer's point of view, it's a very simple thing. How do you govern a business like this, a huge business like this? Particularly, how do you run integrated care unless you have electronic patient records? Thank you.
Thank you very much. Anyone else want to come in on that one, or will we move on? You're okay. Yeah.
I think it just, it's interesting. I do think it shows the importance of, I suppose, the public engagement, public trust in this whole area, because apart from anything else, I think it's a slightly nebulous subject, I would imagine, for a lot of people in the public. We went out and talked about health data infrastructure, they're going, what are you talking about? And yet at the same time, probably a lot of people have that experience where they go and they imagine, they give people the same information over and over again, or they can't get information, or whatever, the frustration around that. So I think probably, the public could be our ally in all of this, if we engage in the right way. So I think that's a very interesting point, actually, that Lisa made.
Okay, what have we got? Declan Devan wants to congratulate you on the strategy. Good to see the relationship and dependence of a supportive national research environment on international coordination and collaboration. I think the international coordination will be trickier than the collaboration, yet COVID has shown a light on how essential all of this is. Any thoughts on how HRB can help the community be part of coordinated international efforts? Please go ahead. Yes. Maura or yeah. Anna. Okay.
I don't know, we all seem to be on mute at the moment, so I'll just...
Well, you go for it, go for it.
Very quickly. Yeah, you're absolutely right. You know, getting involved in these international collaborations it can sometimes be, I suppose a lot of it's actually about finding out what international collaborations are available as well to get involved in. And I think that we have put quite a lot of effort into this over the last number of years, and intend to put a lot more effort into this and put some more resources into it as well over the coming years, so that we can identify for, you know, and appropriately target researchers. I mean, it's, you know, you don't need to get 60 emails every day in your inbox telling you about opportunities, but if we can target people very specifically that we know would be a good fit for, you know, a joint program, for example, you know, we intend to do that. So to help people as much as we possibly can in this area. But yeah, I mean, and there's a lot of stuff flying around as well, so you can kind of get a little bit drowned in it. So trying to kind of tease that out a little bit for people, pre-digest some of the opportunities.
Please, fire ahead, yeah.
Yeah, maybe just to expand on that a little bit, and particularly, you know, I hope to touch on a little bit of this maybe tomorrow as well, you know, in terms of reflections from COVID. I think nationally and internationally, coordination now is something that raises a lot of questions for us as funders, for institutions. You know, how do you get otherwise autonomous entities to come together? And, you know, I suppose the HRB has looked similar to the way Lisa Maria described it in terms of funding, I suppose, to try and get people to cooperate and to coordinate and to come together and to harmonise. So I think that's part of our new world anyway, and I think is a challenge for us all, and how to do it without becoming overly administrative. We talked about administrative burden earlier. How do we not tie ourselves up into legal loopholes, etc., etc.? But I guess the other thing is, I suppose, a reflection that I would have over COVID, particularly in terms of, if I think of, and it seems that Declan asked the question, I'm going to use the example of evidence synthesis. It's having networks that are funded for activities in your country or in your region that you actually want to jump on board organic developments internationally as they arise, which I think we've ably and really well demonstrated in terms of COVID, and particularly in the area of evidence synthesis, working with the WHO, etc. And I'll save some of that for tomorrow. But I guess, I suppose, a reflection as a funder in that respect is we do tend, in the world of funding, to think projects, to think of start, middle and end, to think of you know, milestones and deliverables. We Gantt chart ourselves you know, through life for all sorts of things. And there is something that COVID has taught us about having people with a mindset and having a certain amount of resource, who actually you almost do want them to have the ability to pivot and to jump on board something that's coming, and to talk with the likes of the WHO or others as initiatives arise. Now, I know, you know, we'll be out of a pandemic, hopefully, you know, in the not too distant future. But there's learning in terms of how humans trusted. We're flexible, we're agile, and we had to do things without some of the paperwork. And we kind of had to cross our fingers, close our eyes and say, yes, do it, and hope that the outputs came. I'm not suggesting that the HRB is turning into that funding agency instantly and overnight. There's something in that, though, and we're going to have to do that because everything is becoming large, multinational, cooperative, does need coordination. And again, a point that I make more, everything is now changed into the idea of a start, a middle, and an end has kind of gone out the door, to be honest. We're in living mapping, we're in living evidence reviews, we're in real world data. So actually even finding when something starts, middles, and ends is going to be increasingly difficult. So lots and lots of challenges, but actually I just find that fascinating, really interesting, and would be very, again, it's another one of those conversations that I think we'll be increasingly having with our grantees, but also with host institutions, and with our funder. Because going back to the other issue on administrative burden, I'll just remind people, one of the biggest challenges for us is that we get year by year funding. We give you a multi-annual commitment. We do not get a multi-annual commitment from government. We are the biggest grantee going. We put our begging letter in every year. We usually find out the following June, and we take a punt and we put calls out and give you guys money on a multi-annual. We're not looking for a prize for doing that. That's what we have to do. But it's actually quite challenging. So really important conversations to have in that sense. I would agree with Declan, coordination is key, but it's actually more challenging than it sounds.
Thank you. Anyone else want to come in for there? No? Okay, Grant. Mairead, I have a question for you. What coordination is there between funders, and is there any opportunity to address this in the successor to Innovation 2020?
Yeah, there is good coordination actually between funders. I mean, we kind of work together all the time, and we have a number of things that we do, with SFI, with the IRC. We have, we PPI Ignite with IRC. We have the Welcome Programme with SFI. We have, something else coming up down the tracks shortly with IRC as well. So there is cooperation. And if you look back to what happened, I suppose, when COVID was, we were hit with that was just about a year ago, we got together and worked very, very closely with the other funders around the rapid response calls and so on. But there is no doubt that there is plenty of room for improvement in all sorts of directions. And I do think the successor to Innovation 2020 is a possibility there, or it holds out some potential there. Particularly now with the new government department, I think that there's real scope there. It's almost like it brings HEA, IRC, and SFI all together in one place. So we've got somebody to talk to if we want to talk about training programs and infrastructure and things like that. So I think when it comes particularly to, from our point of view, when it comes to things like the kind of the infrastructures, the things that are really, really important but tend to be nobody's child, it'd be really good to do things on a national basis and to talk to the other funders about things like that and to have some coordination. But I can also see, maybe from the researcher's point of view, and maybe where the question is coming from, you're kind of thinking about coordinating our processes and our timings of calls and all that kind of very, very practical, gritty stuff as well. So definitely there is potential for improvement. But I think the successor to Innovation 2020 will be launched this year. And so hopefully that there will be an opportunity there they're talking about a whole of government approach and, back to the cooperation again. Cooperation is really, really important. Hard to get right, as Teresa said, but it is important. And it is on our minds.
There's a somewhat of a plea here from PIs. So I just, there's a comment and then a question, and you can decide who wants to go for it. I appreciate the effort to improve the quality of the research at all levels, for instance, by including data management plans, reporting, additional training to strengthen the ethics and outputs of our research. But the amount of admin work is becoming unmanageable. What can HRB do to make institutions provide us with real and practical support? Could a budget be made available to get assistance for this? Could be a game changer for new PIs. Any takers?
I might jump in there. This is somewhat related, I suppose, to the first question about the length of application forms and the difficulties that brings with filling them in appropriately, and so that same answer stands. I suppose we do. It is something that we do need to think about where the correct balance lies in terms of helping institutions to help their researchers. There are a number of things that we've been doing, particularly in those new areas. So the HRB has taken the lead in training data stewards in Irish universities and host institutions in something that is, quite a new and emerging and evolving field. It's something that we see as a shared responsibility. It's certainly not the HRB's sole responsibility. And actually, the HRB is not the only funder looking for this type of data management and fair data and those kind of things. So it's something where we're very happy to make a first step, but where it needs to hand over to the institutions as well. Something similar applies around public and patient involvement. Yes, we've been asking much more about that, and it's actually great to see. We've just looked at a number of applications there in a panel meeting over the last 2 days, and the number of PPI co-applicants in a team is really going up, and that's fantastic. But the HRB has, sort of put in PPI Ignite Awards and is now looking to launch this new PPI network in March, so coming up very shortly. And we're very excited about the opportunities that brings. It is not just the HRB's responsibility, it is a shared responsibility across the institutions and the funders.
Okay. Yes, please come on in. Yeah.
I only want to add one bit to that because I think it does segue on from the question earlier about coordination and the opportunity to coordinate across government departments and funders. So yes, the HRB can try to coordinate and streamline as much as possible with the host institutions. Fundamentally, I suppose, having, I think, been leading the way on some initiatives like, leading the discussions around the Open Research Forum, HRB Open Research as an example of how we're taking that forward, fair data, et cetera. I think the ideal or an ideal situation, in a sense, is that we're actually we are having national conversations and we can engage DFARS and other departments in relation to this, because actually the way this is going, I think the supports need to be put in at institutional level, like you said, to support everybody. It would be applicants as well as applicants. Otherwise, we're very aware what you end up doing is doing it project by project, application by application. So I think we're on a journey. If I could say that, it's a bit of a cliche. We've been at the early part of it. We've learned a lot from it. We're ahead on some issues, and I think we would really like to have that conversation. And I'm confident those conversations are taking place. But I think what needs to happen is a model of funding where we can take it up to a more macro level and know that those supports are available and that guidance and that knowledge and those platforms are there across the board. That would certainly make our life less burdensome as well. And I can understand completely why it would make it easier grant application by grant application.
Okay, thank you for that. I have another question here from Ivan Perry. Have you considered joint funding calls with the EPA to address health, social and environmental aspects of the climate emergency? Don't all rush.
A joint group that was convened by the EPA that was looking at health impacts of environmental factors, and the HSE was very heavily represented there, and a variety of different stakeholders, the departments, and the HRB as well. The EPA does have a limited funding budget, so we have not had concrete discussions about a joint call. But it's we are in contact, obviously, and of course, these would be applications that would be perfectly eligible under HRB only award schemes as well. As long as you look at the health impacts, that is fine.
Okay. Right. I'm just being reminded that it's time to draw this to a close. But maybe in handing over to Mairead, I will throw in a question which has been quite popular. It looks like a fairly simple yes or no answer, if there is such a thing. First of all, thank you very much, all of you, for participating in this Q&A. And can I say to Mairead, has the HRB Leaders Award call been shelved? And that's the final question, and I'm handing over to you. Thank you.
Well, I would probably need to get some comment from Anna on that, but no, it hasn't been shelved at all. And I'm sorry now, I haven't got right off the top of my head when the next call will be, but it absolutely hasn't been shelved. We do have plans to support people at all different levels, all the way up from PhD training, all the way up to our research leaders. So there will, in due course, be another call for research leaders. Okay, so thank you very much, Mairead, for guiding us through the Q&A, and thank you again to all our speakers. I won't do a big long sum up here, but just to say I think it was very, very interesting. It was great to hear the presentation from Lisa Marie about the developments in Finland and what they've done to put in place their health and social care data infrastructure. So Lisa was telling us about the effective and safe processing, the way they're enabling that, and access to data, the importance of enhancing data protection and security. And, you know, she was also mentioning, it was a topic of the afternoon, how they were trying to eliminate the administrative burden associated with all of this and improving quality. And some questions came through about public acceptance and of the use of data, which is an important one for us to get right as we start out in this journey. And she spoke about transparency, but also interestingly of culture. And we do hear this, the way, you know, people in Finland have high levels of trust in government and in their health and research systems. But, you know, perhaps we have something here we could build on as well. And maybe that's just something, maybe a good starting place for us. So I think there are a lot of lessons there for Ireland, but you know, it shows what can be done. And as Teresa said, you know, the fact that they really just had a vision and they went for it. You know, some of these key developments, investments, you know, if we get them right, could make a really enormous difference to our health research system. So I think it's worth us looking at this and making that investment in the future. We gave you an overview of our new strategy. We heard about some of the activities that we're going to be working on in 2021. Anna talked about the funding support for researchers and teams, and Maura spoke of our activities in the area of EU and international funding and some of the targeted initiatives that the HRB supports. And then finally, Teresa spoke of our plans in the area of infrastructure and trials and interventions and data, emphasising that we do need to take a strategic approach to those investments, how we need to collaborate with others to deliver on some of these objectives, and of course the need for a national health information strategy, which we will be talking to the Department of Health about. So that brings us to the end of our first session this afternoon, and I want to thank everybody for your time and for your attention and for the questions that you sent in. Tomorrow we're going to focus on the learnings from COVID and how we can future-proof projects for any more unanticipated challenges. Could we cope with any more unanticipated challenges? I hope not, but it is very important that we think about that. And of course, we're going to start the morning with our awards, making our HRB Impact Award. So I want to thank you all very much, and we will see you back here at 9 o'clock tomorrow morning, and I hope you all have a good evening.